Hello, I'm Tiffany Coco, a case manager at Mayo Clinic in Florida. I'm going to provide you with information that will help you prepare for discharge from the hospital following your total joint replacement. The best time to plan for leaving the hospital is before you're admitted. At your pre-operative registration appointment, please bring a copy of your advance directives, such as your living will or your healthcare surrogate designation. When you come to the hospital, please bring information on all of your insurance providers. Once in the hospital, you will meet with a case manager in your hospital room, typically the day after surgery. When meeting with the case manager, you will need to be prepared to answer the following questions. What medical equipment do you already have, such as a walker or raised toilet seat? Are there steps leading into your home? Are there steps to essential living areas inside the home, such as your bedroom? Is the bathroom accessible with a walker? Will the height of your bed make getting in and out of bed difficult? Who will be your caretaker? You and your hospital case manager will work together to develop an individualized plan to address your needs and concerns related to discharge. With standard joint replacement, you will likely be discharged to your home or the home of a caretaker. In unusual circumstances, you might be discharged to a skilled nursing facility or rehabilitation hospital. We encourage you to return to your home as we believe this is the best discharge designation for most patients. Typically, a hospital stay after total joint surgery is 2 nights and 3 days. If your surgery were on Monday, you would go home on Wednesday. Some patients with complex medical issues may be in the hospital for 3 nights and 4 days. Your surgeon will tell you how many days you can expect to be in the hospital. It is important that you plan for discharge before your surgery so that you can go home as soon as possible. Remember, there's no place like home. After you leave the hospital, you will need to continue receiving physical therapy as prescribed by your doctor. There are usually 3 options. The first option is outpatient physical therapy. With this option, you will need someone to drive you to and from your outpatient rehabilitation appointments, since you cannot drive yourself. When you can start driving after surgery is discussed in the Discharge Home video by Dr. Sherman and Dr. Ortiguera. You will go to an outpatient rehab center at least 3 times per week. Physical therapy is usually scheduled to start the day after your discharge, but if you're discharged on a Friday, it will likely start Monday because rehab facilities are not normally open on the weekends. Since you will be on a blood thinner to decrease risk of blood clot, you will need to have a few lab tests done during the first 10 days you are home. These tests can be performed at any diagnostic center, local hospital, and in some cases, your local physician's office. The second option is home with home health care. With home health care, a physical therapist and nurse come into your home. The physical therapist usually visits 3 to 5 times per week to continue your rehab program. The nurse usually visits 2 times per week to check the incision area and perform lab tests. The nurse may also remove your staples if necessary, as directed by your physician. You will still need a family member or friend to stay with you until you are comfortable with everyday activities. Home health care typically lasts 2 weeks before you move into the next phase of recovery, such as receiving physical therapy at an outpatient rehabilitation center. Please review your insurance provider list to identify home health care agencies within your network, or request a list from your case manager in the hospital. Your third option is discharge to a skilled nursing facility. This option is for patients with unique needs and may require a longer hospital stay. Patients are discharged directly from the hospital to a skilled nursing facility. Patients typically stay 7 to 14 days in the facility, but the length of stay depends on their progress. If you are choosing this option, please review skilled nursing facilities with your insurance provider and have 3 potential facilities in mind. Our goal is to discharge you to your first choice, but there may not be a bed available when you need it. Unfortunately, we cannot delay discharge if there are no beds available at your first choice facility. Please tour the skilled nursing facilities you are considering choosing before surgery to ensure they meet your needs. The case manager at the skilled nursing facility will help you plan for services such as home health care or outpatient physical therapy that you may need when it is time for you to go home. When you leave the hospital, you may go by a private vehicle, so you will need to determine who will drive you home. If your trip is longer than 2 hours, please stop at least every 2 hours and get out of the car for a short walk. Even though you are taking blood thinners, our surgeons emphasize that movement is the best prevention for blood clots. So please stop periodically if your drive is more than 2 hours. We can set up an ambulance transport if you prefer. However, this service is typically not covered by insurance. Private ambulances typically charge a base rate plus a cost per mile. For example, If you live 15 miles from the hospital, ambulance services would cost approximately $70 if that ambulance service charged a base rate of $40 and $2 per mile. If you have any questions before surgery, please contact the outpatient case manager at 904-953-6904. Once you are in the hospital, you will be assigned an inpatient case manager who will fully develop your discharge plan. Thank you for your time. It has been a pleasure talking with you, and best wishes on your surgery.